This is a KDKA TV News special report.
Good afternoon. I'm Lindsay Ward in the KDKA studio. We're breaking into programming this afternoon to bring you an update on the COVID-19 situation across Pennsylvania. State Secretary of Health Dr. Rachel Levine is holding a news conference right now to announce new targeted efforts to control the increasing spread of COVID-19. Let's take a listen.
Counties without evidence of improvement, but rather further deterioration. Current mitigation efforts are inadequate and must be increased to flatten the curve to sustain the health system for both COVID and non-COVID emergencies. Quote unquote from today's White House Task Force Coronavirus Report to Pennsylvania. As you know, in Pennsylvania, we continue to see the number of new COVID-19 cases rising, our percent positivity rising, our hospitalizations rising, as well as the number of Pennsylvanians critically ill due to COVID-19 in intensive care units rising. In order to help stop the spread of COVID-19 in Pennsylvania, we are taking targeted and strategic actions. First, modeling available from the Institute of Health Metrics and Evaluation, the IHME model, from the University of Washington projects that Pennsylvania will run out of intensive care beds in December. These models suggest that there will be sufficient med-surg beds or medical surgical beds across the Commonwealth, but it is not clear that they will be available in all regions. And these models actually do not take into account people who may be hospitalized due to influenza. To address this, I have outlined my expectations for acute care hospitals and their chief medical officers, outlining our opportunity to work collaboratively during these challenging times. Our healthcare facilities have a great tradition of mutual aid and support to ensure that every patient gets the treatment that they need. And so, the hospitals and health systems and their chief executive officers need to be working now through our healthcare coalitions and other partnerships to review and prepare now how they will support one another should we get to the point that a hospital could become overwhelmed. Hospitals should also be working now to move up elective procedures and prepare to reduce them if our healthcare system becomes strained. It is my expectation that hospital leaders will use clinical judgment, of course, to determine what procedures can wait without adversely impacting a patient's health. The governor and I are truly grateful to the hospitals and really all of the very brave, courageous healthcare providers who have been on the front lines of this pandemic and actually lost many of their own due to this virus. It is my sincere hope that through continued perseverance, teamwork, and ingenuity, our healthcare professionals will collectively provide Pennsylvanians with the necessary and high-quality care that they have always provided and that our population deserves. Next, I have issued an order requiring anyone who visits Pennsylvania from another state to get tested within 72 hours before entering the state. They need a negative test within 72 hours before entering the state. If you do not have your test results when you come to Pennsylvania, then you need to quarantine until you get a negative test result. If you can't get a test, are waiting for your results, or choose not to get a test, you must quarantine for 14 days once you arrive into our state. Pennsylvanians who have traveled to other states must follow the same rules when they come home. Now, this does not apply to people who commute to and from another state for work or for medical treatment. For example, if you live in Wilmington, Delaware, and work in Pennsylvania, you do not have to have a daily test and you do not have to quarantine. But we do recommend that you telework when possible, and we strongly recommend that you download the COVID Alert app so that you can be notified if you are exposed to another user in Pennsylvania or Delaware that tests positive. This order takes effect on Friday, November 20th. Today, I have also strengthened the masking order that I first issued on April 15th. Wearing a mask is really one of the simplest steps that we all can take to slow the spread of COVID-19. It is critical. We wear masks whenever we are around other people to protect ourselves and protect those we love. In this order, masks are still required to be worn indoors and outdoors. When indoors, masks will now be required anytime you are with people outside of your household, even if you are socially distant, more than 6 feet apart. This applies to every indoor facility, such as schools, gyms, doctor's offices, public transportation, anywhere food is prepared, packaged, or served. And this applies if you have people in your home who are not part of your household. As you have heard from health experts around the country and the world, as well as myself, masks are a simple yet very effective way to limit your exposure to COVID-19 and limit possibly exposing somebody else. Recent data from the CDC indicates that actually it protects you in addition to protecting somebody else. So you're both protected. We must all be diligent in wearing masks all the time. And finally today, the Department of Health and the Department of Education have issued recommendations for colleges and universities that they need to develop and implement a testing strategy to prevent outbreaks among students, particularly when they return to campus from the upcoming holiday break. These strategies include establishing routine protocols for testing and reporting, including testing all students at the beginning of each term, when returning to campus after a break, and have regular screening testing throughout the term. Colleges and universities should also have adequate capacity for isolation and quarantine, and should be prepared to enforce violations of their policies, such as social distancing policies and mask wearing policies. As you have heard me say almost daily, this virus has certainly taught us that we are all interconnected, and it is our collective responsibility to protect our communities and our most vulnerable Pennsylvanians from COVID-19. This has not changed. These strategic and targeted actions are an important start to protecting our communities. Each and every one of us has an important job to do to make sure that schools and businesses can stay open. And importantly, our healthcare system can treat us if we are sick, whether that's from COVID-19 or another illness. We must stand united in stopping COVID-19. We must wear a mask, wash our hands, social distance, stay apart, download the COVID Alert mobile app. We must answer the call and collectively do our part. And as always, stay calm, stay alert, and stay safe. And now I'm pleased to take your questions, and April will work the questions.
Thank you. So you will get a request to unmute yourself when you have a question. When it's your turn to ask a question, you'll be able to ask a question and a follow-up. We'll try to get as many in as we possibly can. First question is Sheldon Ingram. Sheldon, you are unmuted.
Good afternoon. Thank you for taking my question. My question to you, Dr. Levine, is it the intention of the state to enforce restrictions after the holiday season to not further dampen the mood of the general public? When I say further restrictions, I'm speaking of the colored phases, such as red, yellow, and green. Is it the intention of the state to enforce these restrictions as the numbers increase after the holidays?
We have no plans to go back to the red, yellow, green schema.
Secondly, how do you intend to enforce the mandatory mask wearing process, such as in gyms and other facilities where the public gathers?
It really is the responsibility of businesses to enforce the universal masking orders. Now, we don't want businesses and as they enforce those to lead to conflict or anything like that. But I mean, it will be the responsibility of law enforcement and businesses to enforce those mandates when people are in those businesses. And we really expect that and anticipate that the public will come together and we will stand united to be able to stop the spread of COVID-19 and the significant increases that we are seeing as outlined by the federal government.
Next up is Justin Schweitzer. Justin, you have been unmuted.
Hi, Secretary. Thanks so much for doing this. You painted a pretty dire picture when reading the White House Coronavirus Task Force excerpt at the beginning of the call. And just given how bleak that seemed at times, do these targeted measures in your eyes go far enough to address the massive surge that we're seeing that's even larger than what we saw in March and April?
Mm-hmm. I think that these targeted measures are extremely important, and we want to emphasize all of these very important measures. Whether we have to do anything else really depends upon you. It depends upon the public. It depends upon the news media in terms of how this is rolled out, and it depends upon the public. Each one of us taking our responsibility for the common good of everyone in Pennsylvania. And if we all do our part and we stand united, then we might not need any further mitigation measures taken. If people do not follow these measures and our numbers increase as they have been indicated by the IHME model, then I can't predict the future and what will be necessary. So I think it really comes down to each and every one of us and what we choose to do. What we are asking everyone is to stand united to stop the spread in Pennsylvania.